This is Chris Baumgartner, the Drug Systems Director at the Washington State Department of Health. I'm happy to be here with you today to talk about the Washington State Prescription Monitoring Program and how it can help you provide safer and more effective care for your patients when prescribing opioids or other controlled substances. As part of our presentation today, we'll be looking at some data from the Department of Health on the current state of the epidemic in Washington State, giving you an overview of the prescription monitoring program here and how to use it in your clinical care setting. And finally, we'll finish up with some kind of where are we going in the future with the prescription monitoring program to try to make it more effective for providing even better patient care, as well as surveillance and other efforts at the department. Now I'm going to go ahead and switch to my slide set and begin the actual presentation. So I wanted to start out a little bit with looking at the trends in the rate of opioid overdose deaths in Washington State. You can notice we've had a fairly steady level of deaths for several years now when you combine all opioid, both prescription opioid and heroin. You'll notice that we've had a nice decline in the prescription opioid side, but a corresponding increase in heroin-related deaths that have really left our overall rate pretty flat. However, we do like to remind people that based on recent national and local surveys, a lot of people that started on heroin originally started on prescription drugs. And that's important to note as we try to address the opioid epidemic, that if we can prevent more people from becoming addicted to prescription opioids, it should lead to fewer people turning to heroin. The rates of opioid overdose deaths by county is the next slide. You'll notice that it really is a problem everywhere in our state, although some counties have higher rates than others. It's also, as you can see, quite a rural problem overall. And even some of the rural counties that are grayed out on this report still have a problem. It's just the counts were so low they had to be suppressed in this data. I also like to point out that the deaths is really just the tip of the iceberg when it comes to opioid-related disease burden in Washington. In 2014, we had 695 opioid-related deaths, but for overdose hospitalizations, there were over 1,500. Likewise, substance abuse treatment admissions for opioids topped over 13,000. And from the National Household Survey, over 250,000 people non-medically used opioids during that year. This is important to note because, again, it's much more than just the death. There's a lot of impacts and consequences from this epidemic in our state. So what is the prescription monitoring program and how does it work? Well, the prescription monitoring program is a system that collects controlled substance prescriptions into a central repository and then provides that data primarily to healthcare providers so they can provide better patient care. You'll notice that our program had a recent update. We are now collecting information daily from our pharmacies and other data submitters. That started in October of 2016. We do collect all schedules 2 through 5 controlled substances, and we average collecting over 12 million records a year. Veterinarians do have separate reporting requirements when they dispense medications. You'll notice from the diagram that roughly 30% of our DEA registered license holders have registered at one point or time for access to the PMP. We'd certainly like to increase that utilization to better address the problem. Likewise, about 50% of our pharmacists have registered for an account, and other groups such as law enforcement and our licensing boards do have access for investigations. So what are the key prescription monitoring program benefits for a healthcare provider? It can help you check for misuse and, more importantly, help you coordinate care with other providers that may be treating your patient that you're not aware of. Along with that, most of the deaths we experience in our state are polydrug deaths, and you'll notice that the PMP will help you look for those dangerous drug interactions, for example, opioids with sedatives. If you have a patient under a treatment contract for pain management or substance use disorder, the PMP can also be very handy for making sure they're only seeing you for prescriptions, as well as a particular pharmacy you may have asked them to see for all their prescription pickup. Finally, as a provider, you can also check a history of all the transactions linked to your own DEA number to see if they're prescriptions that you did not authorize. This can be very helpful if, for example, a stolen script pad is discovered in your clinic or office. Some key practices to consider for helping you really integrate the PMP into your clinic care setting is to delegate prescription lookup to other staff. So if you have registered nurses, medical assistants, or other licensed healthcare providers who work in your clinic, they can have access to the PMP under your account as a prescriber or pharmacist to look up information for you. Along with that, you may want to train someone who's a technical expert in your staff to be a PMP champion who can help people register for and use the program. As mentioned before, you really should have everyone register for accounts who can have one to ensure you have staff available who can query this information. And finally, we recommend retaining documentation of a PMP report into the patient's medical record. If you made a care decision based on this report, it's very important to document and show the information you had available at the time of the treatment decision. We know that busy healthcare providers don't have time to check the PMP for every single patient that comes through the door. However, we would recommend that there are some essential times where you really should take a step back and look at this information before you proceed. One is when you are prescribing a controlled substance, or really any prescription, to look for those dangerous drug interactions. This is especially critical for new patients, for episodic care, chronic pain patients, and those in substance abuse treatment. Also, be reminded that the PMP is valuable because it helps you see cash payments, which you may not get from other medication reconciliation sources you have available to you. Finally, with the rise of neonatal abstinence syndrome, we highly recommend checking the PMP if you're treating an expecting or breastfeeding mother. This is really important for children who can be born in withdrawal and dependent on these medications, and making for some costly healthcare bills all around. You may be asking how to check the PMP. The best way to start learning how to use this tool is to go to wapmp.org. There you will find a lot of good information, including information to get you to the PMP website at the Department of Health, education and training videos, our statute and rules, and other resources that you can find there. For example, we wanted to let you take a look at some fictitious data to see what a typical PMP report would look like when you bring it up in the system. You'll notice the important information for each prescription provided, including the date the drug was dispensed and prescribed, the drug name, form, and strength, the quantity and day supply, who prescribed it, where it was dispensed, and it also tells you the primary payment method the patient used. You'll notice on the left side that you can query multiple patients at the same time or look up your own DEA history. And at the bottom, you can generate a report, a PDF copy that you can put in the patient chart, as well as map the results if you'd like to see a geographical representation of where the patient lives compared to where the prescribers and pharmacies are that they visited. To give you an idea of what we're collecting every year, here are the top 11 or so drugs by calendar year, starting with 2012, the first year we collected full data for a year. You'll notice a lot of the drugs we collect are for opioids, with some sleep aids like tramadol, as well as some benzodiazepines, and a couple ADHD medications. Most of these have had a downward trend since 2012, which hopefully means we're beginning to have a positive impact on the epidemic. I would like to note tramadol on there, because it only began to be scheduled in 2014 by the federal government and is already the 5th most dispensed controlled substance in our state since becoming scheduled. Some of the future goals we're working on with the prescription monitoring program are both to increase the timeliness of the data as well as improve its data and usability. As I've already mentioned, we have moved towards collecting data daily and away from weekly, which should make the data much more relevant, current, and up to date for healthcare providers. We also have some other ideas we're working on to make that real-timeness even more close. Improving data and usability, we're looking at doing additional accuracy checks on our PMP data and working with pharmacies to correct errors. For those working in border areas, we're trying to explore ways to share data with other states to ensure you have a complete prescription history if your patient receives prescriptions from out of state. We're also looking at making more unsolicited or proactive reports available to healthcare providers. For example, showing them patients who are at risk within their clinic or population. We're working with our vendor to try to better match patient records across pharmacy systems to provide more complete history information. And we've also been starting county health profiles and mapping projects to do more public health surveillance with this data. Our goal is to provide local health jurisdictions and their partners better information at the local level so they can make better use of their resources to address the epidemic. I think the biggest thing we've done lately that is really exciting is improving accessibility through the Health Information Exchange. It's a way to integrate PMP data directly into your electronic medical or health record system so you don't have to log into our system separately from your own workflow. Here's a little bit of a screenshot showing you what we've been looking at using our public health surveillance hat for a little bit. This is calendar year 2014, all controlled substances, the number of recipients in each county per 1,000 residents who received at least one controlled substance. As you can see, again, this has impacted our rural communities in particular quite drastically, as a large percentage of the population in each county is receiving controlled substances. Here's the diagram to help you understand a little bit more about what we've built to connect to One HealthPort, our state health information exchange. As you can see, if a patient presents at either a pharmacy, a doctor's office, or an emergency room, this connection will allow a query to come from the electronic medical record through the One HealthPort Health Information Exchange and to the PMP, providing back the prescription history directly into that system. To that point, we've connected already with the Emergency Department Information Exchange, or EDI, and just that system alone sends over 200,000 queries per month to the system. It's now live in 80 of our 93 hospitals, and we're really excited about what that's been showing. It allows a provider to see the information just based on the patient being admitted to the emergency department. That information is automatically requested when the patient is admitted, and the data comes back. This could also be done, for example, in a primary care setting based on a patient appointment for the next day. To that end, we're working with other healthcare systems. We have 2 that are currently testing and 4 that are going to be starting testing very soon. To help add additional business incentive for healthcare providers and facilities, our program is also available for meaningful use. So this allows you to help meet your public health objectives for stage 2 or stage 3 at this time. We have over 90 registrations so far, representing over 1,000 site locations across the state. A little bit of an update on legislation and rules that impact the program. Recently, we started a new rulemaking, or a CR 101 project, that allows us to update the system based on changes from House Bill 2730 and Senate Bill 5027. 2730 allows those with legend drug prescribing access to also access the PMP, along with those with full controlled substance prescribing authority. And it also allows us to register a facility or provider group for access instead of having to register all the individual practitioners. This should be a real help both for healthcare providers, their systems, and the department by making registration easier. Also, Senate Bill 5027 allows a medical testing lab to access data, compare it to our urine drug screen analysis, and provide a combined report back to a healthcare provider. We also finished some rules this year, or filed a CR 103 to adopt new rules. As mentioned earlier, one of the changes was moving from weekly to daily reporting. We also are collecting a few more data fields in the PMP. And it also authorized through House Bill 1637 access by tribal law enforcement and prosecutorial officials. That brings us to the end. If you're trying to get a hold of any of the great staff here at the Department of Health on this program, this is our main contact line and email address, as well as our website. We'd be happy to help you with registering your staff or helping you understand how to properly use the system. And you can contact us anytime you'd like. If you have any further questions too, just feel free to contact us. And thank you for this opportunity to share this important program with you. We hope you'll use it to better treat your patients and provide better care.